In this video, I discuss one of the most important topics in psychotherapy, how to be more responsive to our patients. My name is Dr. George Silberschatz. I'm the president of the San Francisco Psychotherapy Research Group and the Personalized Psychotherapy Institute. I've been studying, practicing, and teaching psychotherapy for over 40 years, and I'm a clinical professor in the Department of Psychiatry at the University of California, San Francisco. If you're interested in videos like this and want to know when we post new ones, please hit the subscribe button in the lower right corner. The concepts discussed in this and subsequent videos are derived from a model of therapy called Control Mastery Theory. We put together an ebook to explain this approach for interested clinicians. I encourage you to go to our website to download this free ebook at sfprg.org/ebook. The main points that I'm going to be covering today are: what is a responsive therapist, and what are the tools that can guide you to be more responsive to your patients? So, responsive or personalized treatment is becoming practically ubiquitous in healthcare. Treatment that is completely responsive to the individual patient is becoming more and more prevalent in medical care and in other areas of healthcare. Now, psychotherapists emphasize responsiveness in promotional material. If you look at various websites that psychotherapists have, a huge percentage of them will say something about responsiveness or personalizing therapy. And here are just a few examples that I picked off the web. I tailor my approach to your needs. We'll work together to find the best way to solve your particular problems. I'll help you find and develop the kind of relationship that you want, and so on. Now, what does it mean to be responsive to another person? Definitions include concepts like empathy, being sensitive to the needs of someone, or reacting precisely in the manner that is appropriate or right for that particular person. In psychotherapy, responsiveness refers to the therapist's capacity to tailor and modulate therapeutic processes and interventions to patient-specific problems, needs, and goals. But how can the therapist know what is responsive? So there are two dimensions of responsiveness. There's what's called the intended actor responsiveness, and there's the perceived partner responsiveness. Which one is more important? Thomas Aquinas answered this question many centuries ago when he said, "What is received in the manner of the receiver." So how can a therapist develop a better understanding of what a patient will perceive as responsive? Control mastery theory can help us understand patients' experiences and how they shape perceptions. This understanding can serve as a valuable guide for responsiveness. So, what is control mastery theory? Control mastery theory is a model of how psychopathology develops and how psychotherapy works. It is not a new brand of therapy, and it does not privilege particular techniques. Control mastery theory emphasizes and does privilege the importance of therapists being responsive to the patient's problems, needs, and goals, what we call the patient's plan, which I will describe more in a moment. So first, what are the building blocks, or what are the basic foundational elements of control mastery theory? And there are 6 of them. First, the concept of adaptation, that people are wired to adapt to their environment. The concept of safety and danger, the role of trauma and adverse experiences and how those create perceptions of danger. The kinds of pathogenic beliefs or schemas that people develop from their adverse experiences, how patients test those beliefs and schemas, and the kinds of corrective experiences that are likely to be helpful to people. So adaptation, safety and danger, trauma, pathogenic schemas, tests, and corrective experiences are the basic elements of control mastery theory. Now let me just say a few basics about human adaptation. In humans, the key to adaptation is forming a conception of reality. That is, people develop certain schemas about what reality is and what it looks like. And a reliable model of reality is guided by learning about safety and danger. You have to know what kinds of things are safe and what kinds of things are dangerous in order to have a useful model of reality. And the primary forum for developing our conceptions of safety and danger is our relationships with parents and caregivers. So the model of psychopathology and control mastery theory is basically this, that people have adverse experiences, and based on those adverse experiences, they develop pathogenic schemas that would shape their perceptions. So, and these schemas include not just beliefs, but they include feelings, they include relationships, behaviors, and so on. Now, here's an example of a pathogenic schema. A person who was mistreated or neglected growing up developed the pathogenic belief or schema that they are unworthy. They frequently felt sad and depressed. They entered relationships with people who are abusive and who mistreat them, and they engage in self-destructive behaviors. So those are the elements of the schemas, the belief, their emotions, their relationships, their behaviors. Now, the control mastery theory of therapy is basically this, that patients come to therapy in order to disconfirm these pathogenic schemas and to master their problems. In other words, they enter therapy to get better, and they have a plan for doing so. And their plan is to disconfirm these pathogenic schemas. So what are the elements? We often try to formulate what the patient's plan is, because oftentimes it's unconscious. So we have to have a way of developing a formulation of what the patient's plan is. And these are the elements of a plan formulation. We begin with the patient's adaptive goals. In other words, what does the patient want in coming to therapy? What do they want to achieve? And these can be conscious as well as unconscious. Second, what gets in the way of the patient pursuing their goals? And these are the pathogenic schemas. What are the traumatic or adverse experiences that gave rise to these pathogenic schemas? We don't come into the world with pathogenic schemas. We have experiences that give rise to them. So what are the traumatic or adverse experiences that created those schemas? Fourth, how will the patient test those beliefs or schemas in the therapy or outside of therapy? And finally, what kinds of new experiences or insights will help them to disconfirm those pathogenic schemas? So the elements of a plan formulation are the patient's adaptive goals, their pathogenic schemas, the traumatic or adverse experiences that gave rise to those schemas, how the patient is likely to test them, and what kinds of experiences will be helpful in overcoming them. Now, how do patients work to disconfirm those pathogenic schemas? Well, I've already alluded to this. The testing is one way. They can test those schemas in or outside of therapy. They can acquire new knowledge about themselves or others, or they can have corrective experiences, corrective relationships that will provide some correction for their pathogenic schemas. So in short, the control mastery model of the full model of the theory is basically that people have adverse traumatic experiences. They develop pathogenic schemas based on those experiences. The patient comes to therapy with a plan to disconfirm those pathogenic experiences. And finally, therapist interventions are responsive only to the extent that they help patients to disconfirm pathogenic schemas. Okay, I want to give you a brief example now to illustrate these concepts. So a patient, a young woman in her late 20s, comes to therapy because she fights with her husband. She loves her husband, but she fights with him incessantly, and she's coming to therapy in order to better understand why she fights with him. She chooses a Freudian therapist to work with to develop this understanding. she knows that the Freudian analyst is interested in dreams, okay? And she's made it clear that one of the reasons she's coming for therapy is that she's interested in finding out why she fights with her husband. So this is the way the 5th session with this therapist started out. I had an interesting dream last night, and there's a pause. I also had an upsetting fight with my husband, and now there's a long pause. And she says, which would you like me to talk about? Now, the concepts that I've described from control mastery theory can help us to understand this clinical vignette and to assess how this patient is likely to perceive the therapist's response. We're going to focus on adverse experiences, on her pathogenic schema, what is testing, and what might be a corrective experience. So, a rudimentary formulation of this patient's plan shows how early experiences shape perceptions. That is, how this patient is likely to perceive the therapist's response. So these are a few things she mentioned to the therapist prior to this 5th session. First, in terms of adverse experiences, she described that she was raised by a very narcissistic father. The father was someone who needed his children to be exactly the way he wanted them to be. And if they deviated from that in any way, he would become very sullen and upset. So an extremely narcissistic father. Based on experiences with that kind of father, she developed a pathogenic schema that went something like this. In order to preserve a relationship with people, particularly a man, my father, I need to subjugate myself to their needs. So that was her pathogenic schema, that in order to get along, I have to subjugate what I want. In terms of testing, what she's trying to find out here very early on in this therapy with this therapist is, will I need to subjugate myself here with you the way I had to subjugate myself with my father? And with that knowledge, you would very quickly know that a responsive therapeutic response would be to say, if the therapist said something along the lines of, no, I think you should talk about whatever is most important to you. That would be responsive to this patient. And I think you can see why based on the experiences that she had. But what I want to emphasize here is that for a very different patient with different early experiences, this same intervention could actually be detrimental. You might think that how could anyone, and saying something like, talk about whatever's important to you, how couldn't that be helpful to anyone? Well, if you consider a patient who had a different kind of adverse experiences in her childhood, someone who grew up with parents that were overwhelmed by her appropriate need for help and guidance from them. So, for example, when she asked for help with someone, when she was a young girl and asked for help from her parents, and their response would be, we don't know what to do, why don't you figure it out? Well, for that patient coming to therapy, if she was asking the therapist for help or guidance, which do you think I should talk about? If the therapist said, talk about whatever is most important to you, the therapist's intent would be to be responsive, but in terms of her perception of it, she would be likely to experience it as, you should figure it out. You need to figure these things out on your own. So, summary and conclusion. There's considerable evidence showing that perceived patient responsiveness is far more important than intended therapist responsiveness. Control mastery theory provides a useful model for predicting perceived patient responsiveness, and therapist responsiveness to a patient's problems, needs, and goals, that is, the plan, the degree to which the therapist is in accord with the patient's plan, is one of the really important and effective ingredients in psychotherapy. And the effectiveness of therapy could certainly be enhanced by providing more training in this kind of plan formulation in order to optimize therapist responsiveness. Thank you for watching this week's video on making psychotherapy work for your clients. We welcome your thoughts in the comments section below, and hope you'll consider subscribing to the channel. A new video will be posted next Sunday. Take care.